Hi, I'm David Levine. I'm co-chair of Science Writers in New York. My guest tonight is Betsy Ladyzhets. Am I pronouncing it correctly?
Ladyzhets, yeah.
Ladyzhets, okay. And she's an independent data journalist and science writer based in Brooklyn, New York. She runs the COVID-19 Data Dispatch, a publication providing news and resources on tracking the pandemic. Her work has appeared in Science News, MIT Technology Review, the Open Notebook, and other publications. Previously, she worked as a data journalist at Stacker and volunteered at the COVID Trapping Project. So why don't you tell us about the COVID-19 data dispatch and also what you're about, the project to keep how 5 school districts that kept their communities safe is about.
Yeah, so the COVID Data Dispatch started as a Substack newsletter last summer. It was really born out of me doing a lot of COVID data work, both at Stacker, which was my day job at the time, and volunteering at the COVID Tracking Project, and sort of being very immersed in the numbers myself, while also seeing a lot of confusion, both from other science writers, other colleagues, and in my kind of social circles. And wanting to provide some information, sort of explain how data systems work, explain where numbers were coming from, and kind of principles of interpreting them. And in the past, a little over a year since I started it, the publication has grown a lot. It now has its own website. It's not on Substack anymore. It's on WordPress, and it's much more, organized. We've got some resources, like there's a vaccination annotations page that I keep updated with information on different data sources, of repository of COVID sources and other things. And I'm very lucky to have received a grant from the Solutions Journalism Network, which is a nonprofit promoting solutions journalism, to do this project on school reopening. It's become a lot more relevant since I started working on it in May of this year, I must say. So the idea was really to kind of look back at the previous school year and examine the available data, and find a couple of districts or a couple of school communities, as I've been calling them, that really were success stories and that could teach us something for this coming year. Because, living in New York and seeing all of the tension around school reopening, seeing all of the arguments, seeing all of the kind of media perception of, oh, the teachers want this one thing and the parents want this other thing and the administrators want this other thing. I thought, well, there must be some communities that are doing a better job. There must be some communities that are maybe on the same page and that are not just full of tension. So I was able to use a couple of different data sources to kind of identify and then write about those communities. So I'll just share my screen for a little bit, so that I can kind of walk through the data methodology aspect of this. So this is the introduction piece on my website. And so I used 2 main sources of data here. So the first one was a data set from SafeGraph, which is a company that aggregates cell phone location data. You might remember in spring 2020 that there were a lot of pieces from the New York Times and other big outlets that were sort of tracking, here's where people are actually staying home, whereas here's where people are maybe still going out to the grocery store or to restaurants. And that kind of data comes from SafeGraph and from other similar companies. And they have a data set that tracks in-person attendance at school buildings. So I was able to see districts that had kind of the expected drop in building traffic in spring 2020, but then had a bigger comeback in 2021. So that was kind of my first step in looking to see what districts were doing a better job of bringing students back than their peers. And the reason why I say doing a better job than their peers is because it's very important to note that I did not want to and would not have been able to do any kind of like comprehensive ranking here, because first of all, schools, school reopening, as we all know, has been very politically driven. So you can see on this map that there are states like Montana, Wyoming, Florida is almost at 100%. Texas, other states in the South have the vast majority of students back in person, or at least had access to an option that was 100% in person in classrooms every day of the week last school year. Whereas plenty of other states that have a different political alignment, like you can look at Oregon, Washington, California, some other states in the Northeast. Maryland is the lowest, with just 2.3% of students having access to in-person education. So for that reason, it was very important for me to not look at the whole country at once, but to rather pick out individual states and say, okay, what districts in these states did a better job than their kind of neighbors, right? So you can see one of the profiles that I ended up writing was a district in Maryland that kind of bucked that 2.3% trend and did have the majority of their students come back for in-person education by the end of the school year. Although in their case, it was not a full 5-day week, since they had one day that remained remote for a kind of a teacher working day. But still, compared to the rest of their state, this was very impressive. Meanwhile, I wrote about a district in Texas that had literally 100% of students back from the end of the fall semester through the end of the spring semester. So those state-by-state differences were something that I kind of wanted to address with my methods. And then the second piece of the data methodology was looking at state data sources themselves, because in many cases, state public health agencies, just as they've been providing their overall COVID case numbers, hospitalization numbers, vaccination numbers, they've also been providing numbers of cases specifically in school settings, in some cases broken out by individual district or even individual school building. So in working on this project, I focused on the states that have that like high quality data where they're providing numbers, case numbers for individual school districts, and they're providing it for the entire school year. That's pretty unusual. You can see on this map I made that's sort of based on my own rankings of state school COVID data, that New York is doing the best job. I gave them a 23 out of 25 score. Other states are doing pretty well. You can see North Dakota checked off a lot of my boxes for providing data. Texas also does a pretty good job. And then there are some states, which you can see that are grayed out here, that don't provide any data on COVID in schools at all. So they were unfortunately kind of out of the picture for me because I simply couldn't look at case numbers in their districts. Yeah, so that's the basics. And of course, you can go to my site and read the profiles. There are 3 of them are posted right now, and the remaining 2 are going to be up in the next couple of weeks. I'm going to stop sharing.
Okay, so how safe is it to reopen schools? I mean, in New York City, everyone kind of agrees that people do better, kids do better when they're in school. But then we have schools that reopen and someone tests positive for COVID, and the whole school's going to quarantine. What's your feeling about this?
Yeah, I mean, my feeling is that it definitely can be done safely, but there are a lot of preventative measures that need to be in place. And it's even more important this year than it was last year. Like last year, I think there were districts that could kind of get lucky to a certain extent. Like if you look at the district I wrote about in Texas as an example, they did do some things right. They were holding a lot of classes outside. They were opening all the windows in their buildings. You know, it's a district in a part of Texas that has pretty good weather, so they were able to do that most of the year. However, they were not requiring face masks for everyone. Students under 10 were exempt. And there were other places where they weren't kind of following the full extent of the CDC guidance, and they still had a rather low case number relative to their population. With the increasing of infectiousness of Delta, it's hard to say that same strategy would fly this year. And that was actually what I heard from a public health officer in that Texas county who I spoke to. He was like, yeah, they did okay last year, but I'm more worried about it now. And so I think that is maybe the case in a lot of areas, especially maybe more rural areas. where they maybe just haven't had a really significant COVID outbreak yet. So in thinking about, what does need to be done, I think it's ventilation, it's masking, of course, distancing, and surveillance testing, or at least having testing easily available so that once you do have that one student who gets infected, you can easily get everyone else in their class a test and very quickly figure out, okay, do they have COVID? Do they have to stay at home, or can they maybe come back? Because I think that that's really important to kind of minimize interruptions to learning, and also tamping down on an individual case so that it doesn't turn into an outbreak. And so that's the reason why we see a lot of schools doing things like rapid tests for all the students, or like is the case with New York, they require kind of a regular surveillance testing model where like a certain percentage of students and staff get tested once a week.
Okay, for those listening in, if you have a question, please put it in the Q&A box and I'll get to them. So right now, kids 12 and under can't get, there's no vaccine for kids 12 and under. Do you think speeding that up would be helpful?
I think to a certain extent, yes, but it also to a certain extent, no. I think one thing that is important to kind of mention is that for the 12 to 15 age group, the vaccination numbers are actually kind of low. Like I was reporting yesterday on a Gallup poll recently that went out about school reopening. And they suggested that perhaps under 50% of students in that 12 to 15 age group actually have been vaccinated. Because I think there are some parents who are willing to do it for themselves, but are more nervous about their kids, which, is understandable to a certain extent, but at the same time, we know how good the vaccines are. We know how useful they are at preventing severe illness and so on and so forth. So obviously kids should be getting vaccinated, but that hesitancy is rather high. So I think if you have, the approval for kids under 12, there are plenty of parents, and like I know some parents who are raring to go. They want to get their kids vaccinated as soon as possible. But there are others for whom they just would not want to do it, or they would need maybe more communication and more kind of explanation, more outreach, just as we need for vaccinations in general.
But aren't teachers a little bit hesitant about, if kids are vaccinated, would they be more likely to come back?
Would teachers be more likely to come back?
Yeah.
Yeah, I think it probably depends on the district. Yeah.
Right. So the schools that you pointed out, have all those classes open, Florida and some other states, which also have very high rates of COVID. So is that a smart thing then? I mean, if there's a high rates of COVID and all the schools are open, doesn't that mean we're going to see more kids with COVID?
We would probably see kids with COVID regardless, just because of how infectious Delta is. One thing that I think is important to kind of hammer home, and that I've seen from both this project and other reporting that I've done on COVID in schools, is that cases typically come from outside the school. They typically come from a kid's household, or maybe it's like a high schooler who has a part-time job or other kind of social activities. And they come into the school setting from there. And if you have the standard restrictions in place, like masks, ventilation, distancing, in most cases, the spread will not be happening inside the school building, right? So I think it is, schools should be open if nothing else is open, right? Like I think one thing that has been very frustrating, I believe, for a lot of educators, parents, is that there have been instances in New York City, for example, where schools are closed, but restaurants and bars are open, right? And I think if we're going to choose one of those to close, it should be the restaurants and bars. Like we shouldn't be. Obviously, I'm no expert or advocate. I'm just a journalist who reports on this, but that would be my personal view, that you can open schools if you have all the restrictions in place, if you're carefully watching your case counts and all of those things, and if you are maybe using those public health interventions in other areas.
So I heard an argument in New York City that there is no remote option. And someone said,
Yeah.
what if a kid gets sick and they're have to be home for 2 weeks? What do they do?
Yeah, I mean, I understand the no remote option as kind of a way to just get everyone back to in person, because I think New York City has been a location with a lot of hesitancy towards returning to classrooms. Like one of the profiles that I'm writing, which is going to be out not this weekend, but in about a week and a half, is on an elementary school in Brooklyn that had a higher share of students coming back in person than other schools in New York City. But for them, that higher share is about 55%. Now, if you remember, the Texas district that I wrote about has 100%. So that's what I mean about it kind of being relative based on a state and its politics and its attitudes. So in New York, like 55% return to in person in spring 2021 was high. And so I think, the impetus for saying we're not going to have that remote option anymore is just to say, no, everyone needs to be back in person now. But at the same time, that is kind of a one size fits all approach that doesn't take into account like more vulnerable students who might be immunocompromised. And what you mentioned, David, which is, what happens if a kid has to quarantine for 2 weeks? Like, do they now just miss school, even though we now know that we have all the technology to continue giving them at least some learning experience? So yeah, I think it's kind of a delicate balance where you need to still have some option for kids. But at the same time, I think it makes sense to kind of, for educators and leadership to kind of do everything that they can to say, okay, we really want kids to be back in person. We think this is the best way to, make sure they're learning and getting social interaction and mental health assistance and all the other kind of services that kids get from schools.
So Governor DeSantis in Florida is against mask mandates, and he said it should be up to the parents. In New York City, they're requiring masks. Should it be up to the parents? I mean, they're not health officials. They're not, they're not data experts. So.
Yeah, I mean, that's definitely a challenge. Like I mentioned, the district that I wrote about in Texas had masks required, at least last year, they had masks required for kids 10 years or older. Under age 10, they were not required. It was up to the parents. And in that case, I mean, it worked out okay. They did fine last year, in part because they had really good communication between the parents and the school administrators, where parents were kind of taught to look for COVID symptoms or to, keep their kids home if they were feeling ill and that sort of thing, so that even without the strict mask requirement, they were still kind of catching cases before they turned into outbreaks and like preventing that spread in schools, which really is the goal. But then, as I mentioned, Delta is so much more infectious that it's a little unclear whether that same strategy might work this year. And in fact, actually, another district that I wrote about, one in Indiana, they had masks required last year. They did fine. This year, they said masks are optional. That was in early August when their school year started. And then they had such a high volume of cases in the first week of school that they actually switched back to virtual for 2 weeks. And then before returning last week, they said, okay, we're requiring masks again. So they kind of went back to the previous guidance after having that outbreak. So I think that kind of provides an example of, the value of masking in just keeping transmission down within the school setting. Even though there are things that parents can do, and it is important to give parents agency in that way and make them kind of partners in the reopening process, if that makes sense.
So last week, Pfizer got full of FDA approval. I think Moderna will get it very soon.
Okay.
And you have to have, I mean, my kids had to have vaccines in order to go to school. They had to get tuberculosis testing as well. So do you see a time that, possibly next year they're going to say, if you want to go to school, this is a mandatory vaccine? Because teachers, at least in New York, have to be vaccinated.
Yeah, I mean, in some places, yes. Like, I definitely foresee that places like New York will add it to their required vaccine list. But I think the politics of the COVID vaccine will probably not make that possible in all districts. Um, we saw in Tennessee, the state public health department um, receiving kind of a political ban from doing outreach to teenagers. And that was later reversed, but I think that's still kind of an indicator of where we are politically right now and how difficult it is in some places for public health leaders to recommend vaccines. And so, yeah, I mean, just like we're seeing now with mask mandates or with recommendations for teachers to have a vaccination requirement, I think that will provoke similar political battles at town school meetings and so forth.
Well, there are no political battles over the polio vaccine or no political battles over the measles vaccine. No, a little bit of measles.
I mean, I don't know. I'm not fully read up on this history. Like, I think if folks are interested, you should check out the work of Tara Hell, who's another freelance science writer who's done a lot of who's very knowledgeable about vaccination and vaccine hesitancy. But I've understood from talking to her that this is not really, the COVID vaccine hesitancy is not so new. It's just amplified in a way that it wasn't before.
Okay. But in the schools across the country, I mean, everybody gets a polio vaccine. It's not like that wasn't politicized. Most people get the measles vaccine. It was actually people from California who were left-wingers who felt that these vaccines cause autism. So there wasn't really a big argument about getting the vaccines or that they were going to do harm or that kind of stuff.
Yeah, but for a long time, there has been this kind of misinformation and this kind of,
yes,
twisting of stories of vaccine side effects into kind of horror stories and other things of that nature. That just kind of the spread of the internet and of misinformation now. Yeah, and someone just pointed out in the comments that vaccine hesitancy goes back to smallpox, which is what I'm saying, is that there is that history out there.
I don't know anybody that didn't have the. I don't know anyone who hasn't had the smallpox vaccine. So, yeah, I mean, there's all there are people who said TB was going to ruin everything. People will never read a book again.
Yeah, I mean, hopefully, eventually, the COVID vaccine will get kind of grandfathered in like those other vaccines, and the crowd of people who resist it kind of becomes smaller and smaller. But it definitely seems like we're a ways out from that at this point.
So one thing, there are a lot of kids, across the country who are latch kids. There are a lot of people in the country who don't have, parents are working, or a lot of single family homes. And so this idea that the parents can make up their minds, the parents can be vigilant about what's going on with their kids. I don't think that's really happening all over the country.
Yeah, I mean, I think it really, in order to have kind of a successful school reopening, what I've seen in my reporting is that you really need to have that balance and that partnership between parents having agency and parents feeling responsibility for taking care of their kids, but also the school putting certain guidances in place, and maybe collaboration between school districts and public health departments is something I've seen as being very successful, where you have both like, these are the rules that we're all following, but also here's what you can do as an individual parent to kind of promote good mask wearing or promote good hand washing. And the same thing goes for like individual teachers in classrooms who can do a lot to instruct in those kinds of good habits, or who can, be the first, like if you have surveillance testing going on, right? The teacher can be the first to go get tested, and then they could show the students how easy it is. So you can have that kind of like individual motivator balanced with the overall public health guidance. And that's the kind of thing that I think can be really helpful.
So how important is ventilation, and how many schools can afford it or are doing it?
Yeah, I mean, it's hard for me to give like super precise numbers on that since I'm not an aerosol scientist, but I know that um, like ventilate COVID is a disease that may be transmitted through the air, and especially in the case of Delta, where we know that it can be transmitted between people very quickly. It really is important to have that airflow and to have windows open or HVAC filters. And the federal government, through the CARES Act, made a lot of funding available to school districts in the past year. And one of the biggest drivers of that, one of the biggest kind of goals of that funding was to do a lot of ventilation improvements. And so basically all of the schools that I profiled for this project had taken advantage of that funding and done some improvements. So as I understand it, if a school wanted to get that and kind of make some changes, they had the ability to do that. Now, there are obviously some caveats here in that you maybe don't have like the highest quality of it's hard to like investigate every single classroom in the country and verify that it is up to a certain ventilation standard. I know there was actually a big piece at Gothamist and WNYC that was published earlier this week that I would recommend folks check out if they're interested in ventilation. The health and science reporting team there basically investigated ventilation specifically in New York City schools, like analyzing different records of school building ventilation and looking at the efficacy of air filters that the city's been putting in place and other things of that nature. So that's kind of a useful example of, oh, the city says we're renovating all of our classrooms. What does that actually look like? You know, can we say they've been successful? It seems like they have, but they also maybe have more work to do before the school year starts here. Yeah.
So someone asked, have you heard about the Corsi Rosenthal fan air filter?
This is the new homemade one, right?
I don't know. I never heard of it.
Yeah, I'm not super familiar. So I might pass on commenting on it, but yeah, I think generally their school data are limited. That is one area that I can speak with some expertise, is that school COVID data are pretty limited. And I think ventilation is one area where we don't have as much information as we would like. Like in New York City, you can go to a portal and you can look up every single school's ventilation records and see how they're doing. That's not the case for the whole country, but it definitely should be. Yeah.
What strategies have been effective in implementing mitigation efforts in schools at the grassroots level?
Sorry, could you say that again?
What
Oh, wait, I see it.
You can see it. Okay. So what strategies have been effective in implementing mitigation efforts in schools at the grassroots level?
Yeah, I guess I'm wondering how to respond to the grassroots level of this, since I think one of the challenges with school reopening, it kind of harkens back to a challenge with addressing COVID in the United States generally, which is that we have a very fractured public health system, and we also have a very fractured school system, where in the case of, excuse me, in the case of COVID mitigations, a lot of things were left up to either individual states or down to the individual district level. And so a lot of decision making was coming kind of top down from superintendents, from school administrators, from school boards, and really from folks who had a lot on their plates. And, you know, obviously we're doing their best to investigate the latest science and figure out the best mitigation strategies. But you know, it's not as though the CDC can like hand down a policy and immediately have that be enforced everywhere, right? That's just not how the system of public health or the system of education works here. So I think that both gives a lot of power to parents in individual districts in that they can kind of they can influence things at that level, but it also makes things very challenging because you know, your district can be doing a great job, but the district in the next town over could be doing a terrible job. And an outbreak in one place is going to be an outbreak everywhere, especially with how quickly Delta's now spreads. So it's all kind of limited, I think, by that fractured situation.
Here's another question. What impact do you believe social media communications among teenagers is having on the safety of school settings?
That's a good question. I don't know that I've seen much of this in my reporting really. So I don't know if I can answer that.
Okay, so I wanted to ask you about so we, you know, some students did very well with Zoom learning. And I'm reading those articles coming out saying that, but it was mostly kids who had good internet connections, kids who, you know, had maybe babysitters at home. And basically it was upper class and middle class families seem to be, you know, doing better. And kids in the, you know, who were in the lower class were not doing so better. They may have, you know, they may have 5 kids at home and 1 computer. So I think that the Zoom experiment was probably good for some students, but also not so great for some students. Just as, you know, a great, you know.
Yeah, and another thing that I think has kind of gotten left out of that conversation that I didn't really realize until I was reporting this project is that there are plenty of places in the country that don't have great internet. Like one of my profiles is on Garrett County in Maryland, which is a rather rural part of the state and actually borders the National Radio Quiet Zone, which, if you're not familiar, is a region in West Virginia, kind of bordering Maryland, where in order to provide like a large observational telescope with kind of clean readings, they basically don't allow any kind of internet transmission. And so, yeah, it's not a great spot for remote learning. There are also parts in the places in the county, just because of the kind of geographic nature of having, you know, mountains and peaks and valleys, where it's hard to kind of get a signal to work, even if you are able to install a router or install a Wi-Fi hotspot or something in your home, to the point where even the superintendent of the district, when I interviewed her, we started our conversation on Zoom, and then she was just not having great internet that day, so we had to move it to the phone. That's not something that I experience in the middle of Brooklyn, right? But it is something that plenty of people experience. And so I think, you know, in this case, of course, the Maryland district recognized that, and they did everything they could to actually bring hotspots out to students. They were, you know, making hotspots available for families. They were putting hotspots in the school parking lots, at community centers, at churches, and other locations where families could kind of drive and like sit in their car and use the internet. And then part of why they made it a priority to come back was because remote learning was simply not working for a lot of people. And I think there are districts that are like recognizing this issue and that are doing their best to address it. But it really goes to show that you can have teachers doing the best job that they can, and you can have, you know, kids who are attentive and parents who are there to help out. But internet is still a pretty big barrier, and it's something that we maybe don't recognize if we're living in the middle of a city.
So the objections to masks is that kids don't like wearing masks. Is that true?
I mean, I'm not a 5-year-old, so I can't speak from personal experience, but I know that most of the educators I've spoke to have kind of said, and I've asked them this question, I've asked about like testing as well, because I've written about school districts that are doing like testing of students regularly. And both with the mask and the test, you think a young kid doesn't want to do it, but they can learn to do it just like they learn to do anything else. Like they learn to tie their sneakers, they can learn to have a mask on all day, or they can learn to stick a swab around their nose and rotate it a couple of times. You know.
Okay, so why don't you give me an example of one of the schools that you wrote about, and what do they do? That was, you know.
Yeah, so I just talked about the Maryland one. I can also give folks kind of a preview of the profile that I'm publishing this coming Sunday, because I was just working on edits right before this call. So that one is about a very, very small community in Oregon. It's Port Orford and Longlos, which are two kind of towns right next to each other. The school district is just two schools. It's a K-8 school and a high school with a combined student body of about 200 kids. So really quite a small and kind of close-knit community. And one thing that I found really unique about that district was a partnership between the school system and the library in the town. So a couple of years prior, the library of Port Orford actually started running the school district's libraries, because just due to staffing concerns, they weren't sure that they were able to keep the library open with just their own staff. And so the library kind of stepped in and said, okay, we'll help you out with like ordering books, managing your collection, managing your online catalog, and we'll make it part of our library. And so when the pandemic hit, they had that existing collaboration in place, and they were ready to kind of have the library provide more services to the school. So that included opening up space in the library for tech support, kind of early on when a lot of students and parents were struggling with the online learning. They could come into the library and there was like a school IT person in the library who could help them out with their computers. That was, opening up spaces for students to come do their homework. That was, once again, with Wi-Fi challenges. There were some families in the community who didn't have Wi-Fi at home, so the school turned their Wi-Fi router on. And the library also turned their Wi-Fi router on so that you could come to their parking lot and sit there 24 hours a day if you needed to, and have Wi-Fi that way. And they were also giving kind of free like STEM kits, like they had a Lego robotics kit, for example, that parents could pick up and take home and have some kind of extracurricular activities. And so that was really, to me, an example of a community partnership that helped. We had the library kind of helping to fill in some needs and provide both the kind of logistical support with like physical space and the extracurricular support that a very small schools district was maybe not able to provide.
So you gave the example about restaurants and movie theaters, and they're open, and schools were not.
Mm-hmm.
Companies like Apple and Google and most major companies saying that they were supposed to reopen in September, said they're not reopening until January. And the parents are saying, why should, and teachers are saying, if they're not reopening and they don't think it's safe, why is it safe for kids to return to school?
I mean, I think you think about what a community's priorities are. In a lot of cases, tech workers, certain industries can work from home and be perfectly productive from home. That is not so much the case for schools, as we have, plenty of data documenting how remote learning has not been successful for many kids. And so you simply want to think about what your priorities are, and have schools back in person before you have people back in the office, I think is kind of a simple answer.
And also, I think it's good for children's mental health.
Yeah.
I've heard a lot of parents complaining that it's very hard to work at home and have their kids, and also be supervising their kids' education.
Yeah, and I think you also have kind of the inverse example in maybe low-income communities. And this was the case in the Texas district that I wrote about, where if parents are not in jobs where they're able to work from home, but the schools are doing remote, then all of a sudden you have kids who are at home by themselves, and either don't have a lot of supervision for their remote learning, or simply are, nobody wants to be stuck at home by themselves all day, right? Unless you're like a freelance journalist who chooses to work from home, like I do. And even I don't like it sometimes, right? So that's another thing that can happen. Or you have parents who are suddenly like spending a lot of money on childcare so that they can have someone watching their kid while their kid is doing online learning. Like, it's just kind of a mismatched system, I think.
So what do you predict what is going to happen? So some schools are already open,
Yeah.
and what's their experience been?
Well, I think we've gotten kind of a skewed picture this fall because a lot of the schools that are already open are schools in parts of the country that are more resistant to mask requirements and to other safety measures. So we're seeing a school like, like schools in Florida have been open for a couple of weeks now, but in New York City that has, great, or not great, but much better protections in place and is doing regular testing and other measures. Those schools are not going to be open for another week and a half. So we're getting this kind of skewed picture where we're seeing a lot of horror stories from the districts that open with no safety measures, and we're not yet really seeing the success stories from districts that open with safety measures. One thing that I'm particularly interested to see this year that I don't really have predictions for, but I'm kind of hopeful that it's going to be used more broadly is surveillance testing, which I've mentioned a couple of times as like just a very useful safety method. And the CARES Act funding for school reopening actually donated a huge chunk of money. I'm forgetting the exact figure right now, but it's either like $100 million, something of that nature, specifically for testing in schools. And in some cases, there are schools that have taken advantage of that, like New York is doing regular testing. In Delaware, they've made antigen testing available to students. I believe LA County is doing, regular testing. And there are other places that are using it, but there are also places that are kind of still figuring out how to do testing or that haven't implemented it yet. And I think that's something that we really should be seeing more of this year in order to kind of keep outbreaks down so that you can, if you have a kid who is sick, even if they're asymptomatic, they're not showing any symptoms, or even if it looks like kind of a typical cold, that case can be quickly identified. And then you can quickly figure out if anyone around them is sick, and you can kind of move forward with as few interruptions to the school year as possible. I think that's really what rapid and frequent testing can give us.
So have kids, because of last year, do you feel a lot of kids just didn't have a real school year? That they just kind of, some kids did, but a lot of kids didn't.
Yeah, I mean, certainly there are parts of the country where, or school districts, I suppose, where they basically never went back in person, or they kind of stuck to hybrid models, or where you had, as was the case in New York, you had a large share of parents who, even though there was an in-person option available, chose to stay remote. And I think that will probably continue to a certain extent this year too, because you'll probably have parents who choose to bring their kids into homeschooling or make other kind of decisions that feel safer for their families. Yeah.
So I live near a private school. It's a French school. They've always been open.
Yeah.
And I don't know. I mean, I guess they're doing. I guess for a very wealthy school, it's easy.
Right. I imagine they're doing testing and masking and all of the measures.
But they never closed. So which really amazed me. So what else are you looking at? What's the next part of your project going to be?
Well, I'm working on I have two more profiles, like I mentioned. There's an Oregon district that's going to be the next one, and then a school in Brooklyn. And then I'm working on a kind of a conclusion piece that's going to talk about some of the insights that I've been discussing today, just in terms of like, what are the lessons that we can take from these districts? And then, I mean, yeah, I want to keep writing about school reopening. I think it's an incredibly nuanced and fascinating topic. Testing in particular is something that I've kind of been focusing on. And I'm interested to do more on like wastewater testing, which we've seen a little bit at colleges, but not so much at like K-12 schools yet. Looking at antigen testing. And then also, I think a continual push for better data is super important. Like I've hinted at this before, but I think it's important to really say that we are now entering the fourth COVID semester. And we still do not have the federal government providing a detailed, comprehensive data set of COVID cases in schools. There's literally no reason. I mean, I'm sure there are reasons that they would provide if asked, but it's pretty incredible to note that we still don't have this specific data on COVID in schools when it is kind of a documented priority of the Biden administration to get schools open and keep them open. And they've dedicated millions of dollars to a safe reopening and all of this stuff. So why don't we have data kind of clearly showing us how it's going, right? It's a little ridiculous to me, and it's something that I'm going to continue kind of writing about and making obvious until hopefully someday it happens.
So this is a comment from Nadine Yetta. Yeah. Davis Joint Unified School System does weekly testing to all students and staff. We at Davis have an excellent Healthy Davis initiative free, and which is open to all. We use spit testing that comes back in 24 hours.
Yeah, I mean, that sounds like a great example. That's what you want.
Yeah.
Because not only do you want to have regular testing for students and staff, you want to have testing that is easily accessible and that is fast. So that, again, if you have a student who's infected, you can immediately have the rest of their class go get tested. You can have the students' parents go get tested and have all those tests come back within 24 hours.
Okay. I don't know about spit testing, and also I don't know how accurate. I mean, none of the tests are approved yet. They're all emergency.
Well, spit testing, I think, can be fine. It's just a different method of collecting the sample as opposed to putting the swab up your nose.
Which is easier now. So
yeah. I mean, especially if you're doing like an antigen test. I've been I was traveling recently, and so part of my safety measure for that was to do a self antigen test every couple of days. So I've gotten pretty good at it, but it's a shallow one, so you don't have to stick it all the way up into your brain. It's like something that a kid can do for themselves. If
I bought something at Walgreens called Biox.
Yeah, Binax Now. Highly recommend.
It says all positive tests are analyzed. She said all positive tests are analyzed for screenings, which is good. That is good. So how did that? So tell me, what is Substack? Because I don't know what that is.
Oh, it's the newsletter platform.
Okay.
Yeah, it's one of the major places for kind of easily building and starting to send a newsletter these days. I was using it for a few months, but I chose to move off of it in the winter, partially because I was writing very long issues. And my readers were being like, Betsy, this is great, but I'm not going to read a full 3,000 word email every week. And also because I do a lot of data visualizations, which you can probably see from looking at the opening pieces. And that Substack doesn't have a lot of different formatting options. It's a bit better now than it was a year ago. But still, compared to kind of having your own website where you can embed, say, a chart from Tableau, it was not super useful for me. And I wanted, given that my site is really intended to be a resource for other journalists and for kind of folks who are interested in learning more about COVID, I wanted it to be easily searchable, which is also not really something you can do on Substack. So I moved everything over and started using the WordPress website that I have now, where things are very carefully categorized and tagged, and you can get the data visualizations. And I can kind of send people links out to posts without inundating their inboxes every Sunday.
Yeah, because I know one of our past board members and an NSW board member, they send out weekly Substack things.
Yeah.
Anyways, I don't have any more questions, so I think, and it's raining, and I don't want to lose. I lost Wi-Fi like 5 minutes before this started.
Oh no.
So, I'll just read. So, Lisa, I just want to say thank you for answering my questions, and I love your newsletter. I'm part of a country task force in rural Pennsylvania. I invited my fellow organizers to watch us for meeting tomorrow for a school subcommittee, and your comments will be very helpful. So
thank you. I appreciate that. Yeah.
So Betsy, thank you for spending some time with us. We appreciate it. I'm gonna, Joe Bonner, my co-chair, who's taping this, we're gonna put this on YouTube, and so people who missed it can watch it. And our next meeting will be in a couple of weeks. It's a book by Allison Bass, who's a journalist at the Boston Globe. And she has a book out about, she's one of the first people to write about the sexual scandal with priests. And her book is titled Brassy Broad. So that should be interesting. So thank you so much for spending time with us. Everyone stay safe out there. And happy Labor Day weekend, everybody.
Stay dry if you're in New York. It's quite rainy out there.
Yeah, it's raining very hard. Okay.
Yeah.
Take care. Bye-bye.